Is it your heart or is it your lungs? A 55-year-old man walks slowly into a clinic. He looks tired, not sick, just exhausted. He sits down and says, "Doctor, I get breathless when I lie down at night. I have to use 3 pillows just to sleep." Now pause for a moment. Is this his lungs? Is this asthma? Or is something wrong with his heart? Many people experience shortness of breath, but very few understand where it's coming from. And here's the truth. Sometimes it's your lungs, sometimes it's your heart, and sometimes it can be both. Today we are going to break this down in the simplest way possible so you can understand your body better. Let's simplify this. Your lungs bring oxygen into your body. Your heart takes that oxygen and pumps it to your brain, muscles, and organs. Think of it like this. The lungs are the air supplier. The heart is the delivery truck. If the supplier fails, oxygen doesn't come in properly. If the delivery truck fails, oxygen doesn't reach where it's needed. Either way, you feel breathless. That's why heart and lung problems can feel so similar. Let's start with lung-related causes. Breathlessness is more likely from your lungs if you notice wheezing, which is a whistling sound when you breathe. Or maybe you have a persistent cough, you're producing phlegm or mucus, you have a fever, or you feel a tightness in your chest. A history of smoking is also a big clue. Let's break this down simply. In asthma, your airways become narrow and inflamed. Imagine trying to breathe through a tiny straw. That's how it feels. Then there's COPD, usually from long-term smoking. The lungs become damaged over time and air gets trapped inside. Breathing out becomes very difficult. Finally, there's pneumonia. This is an infection that fills parts of your lungs with fluid or pus. You might have a fever, a cough, and a sharp chest pain when you breathe. So if your breathlessness comes with noise in your chest, coughing, or infection symptoms, think lungs first. Now let's talk about the heart. Breathlessness from heart problems often behaves differently. Look for these signs: swollen legs or ankles, waking up suddenly at night gasping for air, needing multiple pillows to sleep, fatigue even with small activities, chest pressure or heaviness, or rapid weight gain from fluid. Here's why that happens. When the heart becomes weak, it can't pump blood effectively. Blood then backs up into the lungs and fluid slowly builds up. When you lie flat, it gets worse because gravity is no longer helping pull that fluid downward. That's why some people say, "I can breathe better when I sit up." That is a classic heart-related clue. Let me give you 2 real-life examples to compare. Person A is breathless, coughing, wheezing, and has a history of asthma since childhood. This is most likely a lung issue. Person B is breathless, has swollen legs, sleeps sitting up, and feels a heaviness in their chest. This points more towards the heart. But remember, medicine is not always black and white. That's why a proper evaluation is so important. Sometimes it's both. Some people with heart failure develop lung congestion. Some smokers develop both COPD and heart disease. Guessing at home can be dangerous. Never ever assume. If you go to a hospital, doctors might order a few tests to figure it out. A chest X-ray can show the size of your lungs and heart. An ECG checks your heart's rhythm. Blood tests can look for infection, anemia, or heart strain. They'll also monitor your oxygen levels. An echocardiogram, which is a heart ultrasound, can see the pumping strength of your heart, and a lung function test measures how well air flows in and out of your lungs. These tests help separate heart from lung causes. Here are some questions you should ask yourself to help your doctor. When did the breathlessness start? Was it sudden or gradual? Does it happen more when you're lying down? Do you hear any wheezing? Are your legs swollen? Do you have a fever? Answering these can help guide your doctor to the right diagnosis faster. Now, there are times when you must seek emergency care. Go to the emergency room immediately if your breathlessness comes with severe chest pain, fainting, blue lips, confusion, or if it has a sudden, severe onset. Please do not wait. Of course, prevention is key. To protect your lungs, stop smoking and avoid secondhand smoke. Treat your asthma properly and get vaccinated against the flu and pneumonia. To protect your heart, control your blood pressure and diabetes, reduce your salt intake, exercise regularly, and maintain a healthy weight. Your heart and lungs are partners. You need to take care of both of them. Let me ask you, do you feel more breathless when lying down or when you have a cough and chest tightness? Comment below. Let's learn from each other. Your body whispers before it screams. Breathlessness is not something to ignore, especially if it's new, worsening, or persistent. The earlier you get it checked out, the better the outcome will be. If this video helped you understand your body better, please like this video, share it with someone who needs to see it, and subscribe for more clear, simple, and life-saving health education. Because here we don't just explain medicine, we make it understandable. Thanks for watching.